My name is Carter Christman. I'm an MS2 at the Cherokee Nation campus. Creed Kilgore and I created a systematic review investigating the impact of health policy interventions for obesity in adolescents. We chose to do this project because childhood obesity is a major public health concern in the United States currently, as it affects nearly 1/3 of adolescents. Now we know that childhood obesity is related to many comorbidities, including type 2 diabetes and hypertension. There is also known correlation between physical activity, diet, and a healthy BMI across the general population, which is also associated with positive health outcomes. Many school-based programs have implemented policies which involve nutritional, physical activity, and wellness education programs to address this. So the purpose of our study was to evaluate these policies and the outcomes that they had on childhood obesity. So we conducted a systematic review using databases such as PubMed, Embase, and Cochrane to examine nutrition, physical activity, and wellness education programs targeting childhood obesity and prevention. We included studies that stemmed from policy initiatives that were implemented in elementary and secondary schools in the United States. The article screening and data extraction were conducted in a masked, duplicative fashion to identify the article's intervention type, duration, and outcome measures. So how we screened was we used a database and removed articles starting with duplicates. Then we moved on to a title in the abstract screening where we removed articles based off of their study design, publication type, and whether or not they were, or if they included the full article. We then moved on to the full text screening where we excluded articles based off of the outcome and population, yielding a total of 15 articles included in our systematic review. The results of our study showed that around 10 out of the 15 were physical activity related, 11 out of the 15 involved nutrition in their policies, and 6 out of 15 contained both physical activity and nutrition in their policy interventions. Also, 7 out of 15 of the articles included wellness education in their primary interventions. Outcome measures of all of the studies use BMI criteria for obesity. 6 out of 15 of the articles reported significant findings ranging from a reduction in obesity to a correlation between the intervention and obesity prevalence. Of those articles, all of them utilized nutritional intervention, and half of them utilized physical activity. In conclusion, our systematic review showed that the majority of interventions published in the literature were either physical activity or nutrition-based and related to state or local policy guidelines. Between intervention types, more publications of nutrition interventions shows positive effect than physical activity studies. As the concerns for addressing pediatric obesity are critical, school-based programs targeting both physical activity and nutrition are necessary, but may not be sufficient alone.